In this presentation, we'll explore the dynamic tissue components of movement. Until relatively recently, fascia was considered to be of little anatomical and physiological importance, and not like the powerful dynamic movement medium that we consider it to be today. The fascial network forms a permeating, connective, interactive continuum from superficial through to the deep layers under the skin. Prime functions are to maintain functional structure and provide a two-way communication system to the tissues it pervades. It has a well-developed vascular and lymphatic system and is richly innervated and underpins the nervous system, conveying nociceptive and proprioceptive information. Fascia varies in thickness and direction. It has acutely reactive physical properties of viscosity, elasticity, and plasticity, with a measure of contractility. At skin surface level, it prevents the skin from sloughing and sliding off from against the underlying muscles. And on a deeper level, it's thought to manage the body's substantial water composition, facilitating fluid dynamics as it blends with the body's tissues, enabling them to function without interference with each other, and thus the body can appear to float within the fascial framework, alleviating pressure on joints. The acutely reactive property of viscosity, whereby it instantaneously turns solid on impact, known as thixotrophy, gel-like substances in the matrix thin when disturbed, such as on impact, and is thought to follow the laws of tensegrity and hydrodynamics, cohesion, adhesion, and hydrogen bonding, perhaps, to provide dynamic form to it. Visualize a tent structure and how elasticated guide ropes would have to be tensioned and positioned to suspend the tent fabric in mid-air to withstand the elements. And if the balance of forces is disturbed, following the Newtonian law of every action having an equal and opposite reaction, this will result in a slackening of some lines of tension and a tightening in others. And start removing the tent pegs after the structure is complete and the structure begins to lose integrity, or in other words, function. And thermodynamics of blood circulation may also play a part in the fascial support system for pliancy. Let's take a look at a video of fascia in the living body. Here we see how fascia removes friction between differing structures. And here is the structure in tensegrity. Recall how it forms with various forms of support where it is mechanically required in strands of tensile strain. When trauma occurs, a role of fascia is to construct a densification of the tissue under repair to provide a controlled, immobile remodeling environment for some 7 to 10 days of tissue level rehabilitation. And the sliding net-like structure of viscous colloidal matrix can change dynamically throughout movement patterns. Fascial kinetic chains have been identified that are synergistically linked together in the body and which activate together, such as the power generating superficial posterior postural fascia and muscles in the human. So the plantar fascia in the calves, the gluteal fascia, the lumbar, erector spinae, latissimus dorsi, trapezius, and the occiput. And consider the riding position whereby these muscles assist with stabilization of the rider. And fascia requires movement for organization. We can see from this diagram of the arrangement of the fascial aponeuroses with muscles how necessarily a well-functioning myofascial system is for the rider, which is quite different to producing their own movement in locomotion compared with having to balance and stabilize on a moving horse. Excitement for the properties of fascia is building among researchers, and it can now be strongly associated with the vitally efficient, economical maintenance of posture. Bordoni and Zania describe it as a sense organ of human mechanics affecting daily postural patterns, such as in this horse here, with a narrow base of support and somehow propping the back. As such, it may equally be closely involved with the development and maintenance of compensatory gait. And the case for optimal posture and learning how to generally improve and optimize gross movement can now be justified. More locally, fascia can be linked with trigger points, symptoms of which are microcontracture, fibrosis, nerve hypersensitivity and hyperirritability, and referred pain. Effects can be far-reaching when trigger points are manipulated, and there is evidence to support the therapeutic benefits of manipulation of fascia. Muscles have properties of contractility, extensibility of up to 50% of resting state, elasticity, viscosity, and that means that the body temperature affects resistance between fiber filaments, reciprocal innervation, as the agonist muscle contracts, the antagonist muscle is inhibited and relaxes to facilitate agonist muscle action. Co-contraction, which means that the agonist and the antagonist simultaneously contract, and that's for precision control. And they have memory in terms of retention of learned skills requiring less conscious input being progressively required. Muscle fiber orientation and the pattern of aponeuroses dictates direction and angle of force exerted by it. So the aponeuroses being here, here, the tree or branch-like aponeuroses here and here. and here. This variety of muscle structures and positioning against the forces of gravity dictates the role of individual muscles as agonist, which acts to produce a movement, antagonist, acting to slow or stop a movement, stabilizer, acting to steady a body part against an aberrant force, neutralizer, acting to eliminate aberrant action produced by an agonist. They can in most cases be precisely located by referring to the bones to which they are attached. So for example, brachiocephalicus being the arm head muscle. Intermediate tissue connects one differing structure to the next and can have the properties of both tissues. The musculotendinous junction is made up of fibres of both muscle and tendon, and at the most central point or regions, properties of neither. And this means that the area is the most vulnerable to injury when stressed beyond its normal limits, either acutely or repetitively. And this tissue typically has a high concentration of proprioceptors. And the implication is that in order to optimize injury prevention, muscle function must be optimized. In the next presentation, we will look at an overview of the nervous system.